So yes, once again, welcome for everyone who is joining, who joined. I know we have a very different time zones here, so good morning, good evening, good afternoon. I'm really happy that you could find the time and join us today. I know that's a very busy time at the moment. And today we are going to talk about the remote support for the healthcare industry. This is a very actual topic at the moment, and we definitely want to pick it up. So I hope you can see also my slides well. And just as a little introduction, you also can post your questions and we will be able to see them. You will be able to post it through the tool. I see already some of you did post the comments. Thank you for this. And we are going to handle them in the end of the presentation, but I will be keeping my eye if you will have any remarks or if you will not be able to hear me or something. So just let me know. Okay, so let's start. So, as Dr. Grossman said, I'll just quote in this case, "I know the exponential development of technology and its smart use will profoundly positively impact the healthcare system in ways that are difficult to even imagine." So, and we here definitely agree. We see that the technology, it's transforming the way we work. It's transforming the way we work already today, and it started already a long time ago. But as now, it's getting even essential. It's getting essential so we can continue working in the current times when we are not allowed to travel, when we are not allowed to go from one location to another and support our colleagues or work directly with our patients. And that's why, as the leader in the industry, we do not want to stay aside. We want to contribute, and that's why today we invited our guest speakers and experts in order to share their perspective into the situation and share their ideas, what needs to be tackled and how it needs to be tackled. And that's what we are going to address today in the webinar. So the agenda for today is that we're going to start with the introduction, of course, of our guest speakers. We are going to talk about the current situation. So to really understand what the problem of the current situation is, and of course, most importantly, look into how we can solve the issues in healthcare. How can we start solving it? What solutions are already there in the market and what we can start using today. We will also get familiar with a quick start, so what you can do to enable your team basically in a matter of a few minutes, so everyone is feeling enabled and you can continue working as you did before, even maybe more efficiently. And at the end, we will allow enough time for the question and answer session. And please do not hesitate to ask questions. We also would like to do it as a live discussion, and we should definitely make a use of our guest speakers who are joining in order to share with us their expertise. That's why we're here today. So, but before we start, I would like to ask you to participate in a short poll, because we would like to know which industries you are mostly coming from. And in order to know, basically, if majority of you are coming now from the healthcare or you're coming from any other industry. So we already see that's already in progress. Oh, a lot of participants from the healthcare. That's wonderful. Okay, thanks everyone who participated. And I see that we have a lot of participants from healthcare, but we also have different sectors like IT, manufacturing, logistics, and etc. So that's wonderful that everyone is joining, even though you're not directly from the healthcare industry, because I also believe that everyone will benefit. And this topic is, of course, it's important for all of us in this current days. So, okay, now you can see my slides further, I believe. All right, so it's the time to introduce our participants. I didn't introduce myself because I wanted to do it with everyone else. So, hello, I'm Tatiana. I'm a product manager at the company Ubimax. I believe many of you are already familiar with us. If not, I will also do a short introduction in a moment. But in the center today, we'll, of course, have our experts and the guest speakers. We have Dr. Rafael Grossman, the healthcare futurist and the surgeon educator. We can see him live now. And our partner and CEO of Event Horizon Technologies, Frank Escandell. Okay, everyone, thanks a lot for joining. Thanks a lot for taking your time. I know how busy you are. I know, Dr. Grossman, that you have operations happening in the moment and you just took the time to talk to us. So we will also try to keep it quick. And Frank, I'm looking forward to you to share the expertise with us. And if it's all right, we will be talking in our first name. So Rafael, Frank, I hope this is all right for everyone. So I'll just do a very short, perfect. I'll just do a very short introduction of UbiMax, and then we'll just, then you can also go ahead. So as I said, I believe many of you already know the UbiMax. We were founded in 2011, and we already have actually over 400 satisfied customers around the globe. We are operating with our headquarters from Germany, but we have multiple offices, basically multiple in Germany, and we have the offices in the US and in Mexico, as you can see here. So I know that you're reaching out also here to the webinar from different parts of the globe, so we are eager to support you from very different locations. So we have a lot of different customers from very different industries, and most importantly, we collected really a lot of years of experience. I would say in total, it's now already over 15 years, because the colleagues who joined the company before, they were working on this topic of the wearables, of the hands-free operations from the frontline workers, independent of the industry already before. And now as a team, we're already over 100 people, and we are not stopping to grow. So this is, of course, enough about us. Now let's start with our guest speakers. Frank? Frank, we cannot hear you.
Oh, yes. Now? Okay.
Yeah.
Well, hello, everybody.
Perfect.
Good morning, good afternoon, good evening, wherever you are. Thank you very much. My name is Frank Escandell. Our company, Event Horizon Technologies, is based in Spain, and we are partners to UbiMax. Now that we're going now into the so essential, is so necessary nowadays with the SARS-CoV-2 pandemics. Okay, so it's first of all that's, and second is an honor to it is like you're going out there and be on the same team as your favorite rugby player, and that's, I'm a fan of Dr. Rafael Grossman, of course, so it is an honor for me to be sharing space with him.
Perfect, thank you, Frank. Rafael?
No, thank you, Frank. Well, thanks, Tatiana and UbiMax for inviting me. This is really for me an honor and a pleasure too, and really it's a responsibility. I think that is really important for professionals in whatever profession it is, but especially these days in healthcare, to be able to connect and to deliver a message. I'm a general surgeon, a trauma surgeon, a full-time employed surgeon, so I'm clinically active basically 24/7. But on the side, I really feel that it's really important to be a preacher, an evangelist of how technology used in a smart way can really make healthcare better, because healthcare needs to get better, because healthcare is a human right. And especially these days, I think that we have all the technology and we must use it. And not just healthcare, but also education. And these times have really proven that to be very, very valid. I'm from Venezuela originally. I live in the US, where I trained in Ann Arbor, Michigan as a general surgeon. And then I've been in Maine working as a general and trauma surgeon who also does advanced laparoscopy and robotics for the last 16 years or so. And I guess my main claim to fame, other than a few TEDx talks, is that I was the first surgeon who ever used Google Glass to stream an operation. And that was sort of a very intuitive use of a very clever technology in order to connect and communicate better with my students. And that took a lot of excitement, and I started sort of a career as a communicator, as an evangelist of how technology can make a human better, and also make us more human in a way, because technology can paradoxically make a healthcare more humane. And I think that's part of the point of this webinar.
Perfect, thanks a lot for the introduction. I mean, we are really, really excited to have you here. First surgeon. Can you hear me? Yeah, okay, perfect. Yeah, I know that people now already don't have this perception of the consumer device, right? Because in the very beginning, people saw it as a consumer-oriented device. And now it's very exciting to see and hear, like that you already use it multiple times, and you see it also as one of the major tools from the new technology. And I know that you also have the blog, which I think you would like to share with the audience. I think it's definitely noteworthy. So would you like to say a few words about it?
Yeah, absolutely. Becoming a sort of an educator and a communicator, I felt the need for creating a platform. This is a completely non-commercial blog. There are lots of links and apps and platforms and books that I share with no basically a conflict of interest at all. I just whatever I feel that it's a good platform, I try to engage with them to help them shape the platform from the point of view of a clinician. So I'm always open as a resource to really help, and that has been a lot of fun, because if you see my office is full of devices and prototypes, and it's gotten me the chance to meet people like Frank, for example, who in the early days of Google Glass, was really one of the pioneers, one of the innovators as well. So my web page is there. I'm very active in Twitter and LinkedIn, and those are really the platforms that I use to engage, to communicate, to connect with the world.
Okay, that's wonderful. Thanks for sharing. I mean, and everyone who's interested, please also, here is a link, and it will be also shown at the end of a presentation, so you will not miss it. So you will have a chance to connect. Yeah, so let's jump into into our core content also for today, into the current situation. So, Rafael, can you please share with us what do you think, basically, of the known graphs that everyone probably already seen? But what is your perspective on that? And yeah, so please share.
Yeah, absolutely. Well, I don't want to get into too many details really, because all the details change by the minute, as you all know, and we're bombarded with too much information, and sometimes you get a little bit of a alarm fatigue. You don't want to read or hear anything, but it's a terrible pandemic. As the word means, it's a global problem, and it has really, in a way, connected us in ways that we never felt or thought or could imagine before. As it started back in the last days or weeks of the last year, now we're into the fourth month of this problem, and it has hit everyone very hard. And places that are saying that they're not hit is probably because they're not testing. And as we all have seen the big curve, the big almost exponential curve, we know that we can make that curve flatter. And you see the hashtag flatten the curve, and how do we do that? And the measures are taking effect, and more or less, depending on how strict the social distancing is happening, how strict is the testing happening, how available it is. All those are factors that are really, in addition to the natural course of the disease, the natural history of the disease, is really going to make a difference. Certainly social distancing is what can really get us there in a way, because social distancing flattens the curve and in a way spreads the disease over time and allows us to catch up, because no healthcare system in the world was prepared for this. And some countries fared better and are faring better. Most of the world, it could not even imagine that this was going to happen. Back 100 years ago in 1918, when the so-called Spanish flu hit the world, it was a terrible problem. And we are seeing something in a way very similar, except the world is very different. Now we have lots of tools. Now we have technology. We have ways to connect. We have ways to really examine things and act on things in ways that we could never conceive before, especially communicating. It took days, weeks, months for a message to go from here to there. So even in the medieval times, in Italy, even in northern Italy, where the hardest hit area was, you could see that they would close up small areas, city states in a way, and they would send a messenger, and when the letter got there, they would close the area and they would lock down, and that way they'll contain the disease in a way. So that's really where we are. And the good news is that I think that it's going to get better. It's going to get better because people is realizing, most people, not everyone, but people is realizing that this is beatable. And at some point, we'll have a better treatment, pharmacologically speaking, very likely. Not yet, because there hasn't been enough time to do randomized controlled trials. And also at some point, probably in a few months, we're going to have hopefully a vaccine that hopefully will be effective, because the virus mutates constantly. We've seen several mutations. So all over the world, there are over 2 million cases. There are about 136,000, I think, 140,000 deaths globally. In the US, where I am, every time I check, the numbers are higher, and depending on the area. I live in Maine, which is New England, which is kind of the top of the New England area. New York, as all know, very hard hit. In the U.S., we have about almost 600,000 cases, and we have about 28,000 deaths and counting. And the cases are the ones that we know. We are testing, but there's not enough tests to be able to test everyone. And if we talk about antibody testing, which is really one of the good news, antibody testing will allow us to determine who was had the disease and who has recovered from the disease and has developed antibodies to the virus. So those are the people that will be interesting, because that might help us sort of release the social distancing measures in a better way.
Yeah, that's definitely a valid point. And I think that you said that you believe it's going to be all better. That's what all of us want to hear, actually. So we want to definitely believe in this, and that it will get better. That's definitely the hope. And what you just mentioned is the social distancing is definitely also a solution here, right? But social distancing means that you cannot travel. It means that even if your expertise is required somewhere else, you cannot go there. So what we discussed also before, right, that what we need is to increase actually the capacity of the healthcare system. And with the social distancing and with the people at the risk group, you cannot that easily go there, right? So let's maybe now jump into the few solutions that we think that should be done to do it, right? So let's maybe start with indeed increasing capacity.
Absolutely. It's all about demand and supply, right? So now we have a tremendous demand for healthcare providers, and the supply is very low. We have a tremendous demand for healthcare experts in ICU care, intensive care unit care. We have a demand for ventilators. So we're trying to demand for PPE, for personal protection equipment. So everything has to be so. In the case of healthcare providers and expertise, so how do we account for that? How do we balance that scale? And it's by what you guys represent. Technology is used in a smart way to connect and communicate better. It could be a Google Glass. It could be a device like the Blade from Vuzix, okay, which is basically like a smartphone and a laptop in your face.
You're fully equipped.
So, well, all those devices are just devices that in a way might have been designed and invented for playing, but these devices, this is the magic leap, potentially could save a life. So I think that only technology used in a smart way will basically increase that healthcare system capacity. No other way.
Yeah, definitely agree. And what we also thought, what can be done with enabling hospitals, enables caregivers, and generally the healthcare system participants, is to also enable the experts who might be at risk, right? Like retired doctors, they're in a risk group, or people who might be in quarantine. So if they have this expertise, of a specialist, they can still put on the smart glasses equipment, right? Or just use your existing hardware to provide the remote support. And by that means we could also treat more people with the time, right? So that we expand the capacity, that we enable others to support where the support is needed. And what you just also mentioned is supporting with intensive care units, right? Like many people who are being now onboarded are juniors, right?
Absolutely. It's not about, just counseling, treating, advising patients, but you can advise providers who have less expertise. You can train providers. You can really extend, virtually, remotely, with no barriers other than connectivity, right? And the actual hardware, which, like you said, it could be a complex hardware, could be a basic hardware, could be just a cell phone, could be a smartphone. You can really, from text to video conversations to avatar, 3D holographic connections, all the way in the spectrum, you could really extend that person's expertise. So training is very, very important. You know, you have places where you might have no ventilators. You can buy ventilators, but how do you buy the expertise of someone who's trained to manage a ventilator, for example? So there are many, many instances of a remote training that are very, very important, and that's where you guys play really an important, very, very important role.
Thank you for your words. I mean, we are indeed organizing also this webinar because we want to enable people in healthcare to start already today, because the solution, it's incredibly simple, right? You use it, you just turn it on, and you already intuitively know what to do. Was it your impression, right?
Absolutely. You know, it's it's so easy nowadays. And the coronavirus is forcing us to become comfortable with this type of connection. And when you open a platform, the platform has to be swift, has to be user-friendly, has to be intuitive. It has to be someone who might not speak the language, someone who might have an advanced age and is not very technology friendly. Then they can just navigate very easily and with very few steps, see what we are seeing right now, that level of excellent connectivity.
Yeah, thanks a lot for sharing your opinion. I mean, that's indeed the case, right? And I also heard from for example, I have a friend also, she's working in a hospital, and she says they get so many new people and they just don't get this capacity to train all of them, because they just can't. And these people, they're eager to help, but they also do not necessarily know what to do, right? And maybe they don't even have an expertise in a hospital. And then you could dial in and consult them via remote. And this is not like having a scheduled meeting tool, right, which we're all familiar with, because a scheduled meeting means something is scheduled. But in healthcare, there are a lot of emergency situations, unfortunately, a lot of situations where first aid is needed, and that's where remote support definitely comes in play.
And Tatiana, let me mention briefly also, we've been doing a lot of telemedicine for years. So we're trying to, and a lot of barriers. Now, suddenly the coronavirus basically evaporated all those barriers from the regulatory, state level or national level. Many of the barriers of privacy, which is very important. Privacy obstacles, the culture, the education of the providers, of the patients, everyone now had to do it. So it was not a necessity, it was desperation was the mother of invention. And now you have so many wearable devices remotely that can measure, your pulse, your temperature. You might have a watch, you might have a blood pressure device that can remotely send whatever number of variables to your provider. So your provider connected with a platform like yours, for example, can get all sets of vital signs and important medical data. So you really don't need that physical contact. And it's not a displacement of the traditional way of doing medicine. It's just a complement, a supplement to traditional medicine. So we can have, we know that about 80% of the visits don't require physical touch. Well, right now we can do the physical touch no matter what. So we can really do much better medicine than we could, a very short time ago by using, telemedicine platforms, telehealth platforms like the ones you have designed.
Yeah, I mean, we also definitely see technology as enablers of the current experts, right? It's not at all a replacement for anyone, and will never be, right? It can transform information to us. It can enable us with more information, with analytics, with providing something like automatic reports, but it will never replace the expertise you are currently having, right? So,
absolutely.
One more use case I would like to share, where we also see a lot from our current customers deploying it, is also very directly related to the healthcare system. It's a smooth operations, what means having the medical and pharma equipment running smoothly. So all these travel bans, they're also definitely having an impact on it, right? Because the equipment still needs to be maintained, it still needs to be produced. We know that ventilators now is the very essential medical equipment, and it needs to be there, right? And technicians must go and do a proper installation, maintenance, and etc. And this also is the current state, not that easily done. And that's where also remote support comes in play. And that's what we see our customers who were using it already before. They're just ordering more and more licenses now, because they cannot cope with the demand otherwise. What we also see that's also interesting, so the company is not necessarily operating only within, for example, if it's a manufacturing, like a pharma equipment manufacturing company, not only enabling each other, but they do have such situations where they actually enable their customers, right? It's actually maybe the majority of the cases where they provided equipment to their customers and then it requires inspection and they cannot go there. So they easily turn on the remote assistance solution and have all the necessary tools on hand in order to basically do it, right? To do it via remote and enable the customers to do the first level support when needed. So I just wanted to bring a short example, for example, from our customer Becton Dickinson. And basically, you probably know Becton Dickinson. It's also the manufacturer of the medical equipment. And the situation there that was they needed the troubleshooting in the real time, but the expert was sitting basically in the California, and the support was needed in Mexico, right? So they couldn't enable it that easily, and that's why they started with remote assistance solution. I have a very short video to show, but I saw the short video is also a good visual. So I hope you will be seeing it in a second. Yeah, you see it? Okay, I hope you can hear me back. Can you hear me?
Yep.
Okay, perfect. Yeah, I hope you could also hear a bit of, there was a music in the video, I couldn't hear it, but I hope
Yep.
it was working for you. Okay, perfect. Yeah, so it was just a little demonstration how one of our customers who is producing the medical equipment is using the solution every day. They are using, for example, the Vuzix device, right? But there are also different other options. And this is just one of the examples, right? And it's also just one of the use cases. And we see a lot of different use cases and potential, Rafael, as you just mentioned, where such a, you may think from the simple solution as a remote support, but rightly done, can really solve so many issues per remote, right? So the question is, okay. The question is, so what can help at the moment, right? And I believe that would be not a secret for everyone that we are talking now here about the remote assistance solution, of course, but I would like to make a point why this solution is actually the right one for this moment, right? Because there are different things like Skype also, for example, right? And people are asking, okay, I can maybe use Skype, but those solutions like Skype are not necessarily done as a first place, right? For the direct and emergency remote assistance at hand, which enables you to work with both hands free. And that's very essential, especially for the frontline healthcare workers, in order to pay the full attention to the patients, for example, right? Or for the medical equipment that you need to provide the maintenance. And that's why we would like to basically enable your team already today, right? And for that exact purpose, we also suggest that you can use as a first step existing hardware, right? You can take your phone, and everyone has a phone nowadays. You can have a phone and have a remote assistance solution installed right there, out of the box. There is not really not much to do, and then you're ready to go. I mean, Rafael, you also demonstrated very many different smart glasses. Thanks for this. You are really an innovator in the area and the healthcare futurist. That's not a doubt. And this is definitely also an opportunity, right? We can also enable the operations with the smart glasses, which is as we see brings the most advantages because you definitely work with the hands-free. But in order to start fast, you can also go ahead and take your existing device just because it's so easy, because everyone has it. And for example, I would like to mention the few functionalities that are available and which make, for example, a solution really stand out and beneficial for the healthcare sector. And some of them are quite simple, right? For example, like drawing on the screens or setting a visual marker when you would like to, for example, point out at a special area, right? Which when you get a video stream. So imagine if I'm a caregiver, right? And I'm sitting in front of the patients, and you, Rafael, then can give me the advice, right? And then you can also manipulate with my screen. So I can just understand not only with the audio what you're going to say me, but you see my video and you can also interact with this. So we have indeed an interactive session. It is device independent, what is very important, but what is most important is, for example, we have such thing as a guest licenses. Guest licenses means that if I have a solution, or if you have a solution, and you want to, and I would like to ask for your support, you don't need to have it. So I can just send you a very easily the guest invite via SMS or email, and you just can click the button, and without installing the software, you will be able to join.
Yeah.
Yeah. So, and this is also what we did also the other day. And this allows you to really get immediate support from someone who has an expertise, but you cannot maybe foresee every person before and give them the license or whatever program you need to get installed on a computer. So this is not necessary, right? And we also have a very extensive experience with integrating our solution into the backend system, right? And EMR or EHR in healthcare is very essential. So this is something that also can be done, and then it's directly integrated into your backend. Besides, documentation is another point. I will not go very deep into this, but for example, after a very simple remote assistance call, you can have the automated report just being generated, right? And everyone who had an access, who participated in a call, can edit it. And then you have documentation already stored. And as I said, if you have a backend integration system, it's already stored directly in your system. So you don't have to go and type it per hand like many doctors or many caregivers still do it today. So it's will save tremendously the time. Frank, are you still here? You're a bit frozen, so I'm not sure.
There's the microphone. Okay. Yes. Yes, indeed.
Okay, your camera is a bit frozen, but yeah. Go ahead. Sorry.
No. That's all right. Talking about the features of Augmented Support 2.0, in this case, AS 2.0, being a secure software as a service cloud model platform that basically for those visitors, that they are listeners out there, it basically enables the audio video streaming users in a flexible, versatile, and scalable way. And I say users, independent of what kind of hardware they're using, as you pointed out before. Also, very important because, of course, especially in the United States, they're going to be asking the questions, and it is indeed a very important issue with HIPAA and for example, EPHI. Dr. Grossman, well, Dr. Grossman is here. I will not go into that, of course. Okay, that's a very important issue because yes, it has to go there, but right now this solution is ready to go. Okay, so when we're talking about security and how secure it is, it is 256-256 bit encrypted. Okay, and this is what is really important, that the listeners out there get this information. When we say that it is encrypted information streams, okay, UBMax really nailed it this time. Really nailed it, because you can tell that this is patient first focus. That's really important. That we're not going into any technicals. We can discuss that when we contact you, of course. But it is patient first focus. For example, let me give you an example. I was running tests with my trial license. I was running tests with basically doctors here in Spain, where we are based. Okay, so one of them, came up with this idea. It's two ideas basically. One is that with the guest licenses, you have a number of licenses per package, right? But you also have the possibility of having a number of guests. A guest means a user on the platform that it doesn't have to be registered on the platform, but can have a punctual 24-hour term license, so you can have contact back and forth with this person in the term of 24 hours. So the idea was basically a very, as you said, Dr. Grossman, a very human and humane idea. Basically, the patients right now, what's happening out there with the pandemics. The patients out there right now, that they are alone. They cannot, the visitors, the next of kin, their relatives cannot be with them. And it is really tragic here in Spain. What's happening is that there are, especially there are elder people, they are passing and they are dying in hospitals and nobody can go and see them. And this doctor friend of mine said to me, just imagine this solution you have right now. Imagine a sort of a virtual a bulletin board at the nursing station. And every day, for example, the nursing supervisor is going to have the number and the contact information for the relatives. And at an appointed time every day, they are going to call them. It is very important for these patients to have contact with the relatives or next of kin. And this platform facilitates the contact between these patients and these patients, as long as they're conscious, of course, and the relatives. Let's say 5 minutes a day, 10 minutes a day, that they can see each other, they can talk to each other, they can listen to each other, and that is very, very important for patients' health in this case. And that's what encrypted information streams is all about in the end. It's all about the patients, as well as all the information that Dr. Grossman and Tatiana has given us. When we talk about data safely store, we have said that this is a software as a service cloud. Okay, so it is native. Okay, it remains there. It means that it is ready to go. It is ready to be used right now for all the use cases that are possible in the clinic or hospital or facility you're working on is going to deploy in. Okay, and also very important, because you would say, or any of our listeners out there, they would say, well, I can do that with, I don't know, WhatsApp, or I can do that with Zoom, or all these streaming platforms out there. Well, but you are not in control. So secure and individual system logins means that you are in control, because you have to access the platform and you are the one to determine, okay, who is going to have access to the two-way audio video calls and who are going to be your guests. And that is mostly important, okay? And also talking about the, say, a quick start, the package itself, okay? Which is basically what we call the AS 2.0 quick start. Basically, we have, thank you. So basically, we have this basic package for easy and fast deployment with the existing hardware. Just to tell you that Android, for example, you're required to have from Android 4.1 and from iOS 11, yes. Okay, you're required to have that basically. So whether it is tablets, whether it is smartphones, or where in this case you can use it also on the laptop with the for the experts in this case. For these basic packages, we have 5 licenses. 5 licenses means that you're going to have one supervisor. 4 other licenses is going to be for your, basically, you can have these rotating licenses for physicians, for example, like Dr. Grossman. Every now and then that they come in and out of the hospital, or even when they are out of the hospital, they are reachable using this secure platform, okay, in a number of licenses. It is a fixed package right now, but these could be easily customized. It is customizable and it can be personalized, okay? Also, the services as they are included on setup, for example, on the cloud, the training, very important. I mean, this is, the training is a 2-hour training session. However, I can tell you by experience, 10-15 minutes, you get it. It is really, really easy. It's really flexible. It's just wonderful. Okay, and then the individual extension, the smart glasses. That's important because although you're not required to have smart glasses, but you can tell, also you can tell, sometimes you have these personnel out there, these technicians out there, sometimes some of them have to use these PPEs, this personal protection equipment, right? And I cannot imagine hours and hours being inside this PPE for hours. That must be, that is some kind of exhaustion right there. So basically, if you are using smart glasses, it has to be, we will recommend what kind of smart glasses you can use. You can use your own smart glasses as long as they are, for example, Vuzix M400, a RealWear HMD1, or for example, the Epson Moverio BT350, for example. Those are the ones we recommend, okay? So here is the pricing. And we also have like packages of for guests. So we have a number of guests right now, and say, for example, that you're going to have say for example 120 guests per month. So you have these, you buy these packages at this price you see here. The price you see here is an annual price. You pay this on a yearly basis, okay? And then the guest packages, you can pay that as a flat rate, or you can pay that per month, or you can have that as an annual rate as well. So as you can see, it is very easy. He says 5 licenses, but said, well, I don't need 5 licenses, I need 7. Yes, we can do that easily. It's not a problem. Or we need 10. That would be another package that is not here on the screen right now, and we need other 2 extra licenses. We can do that as well, and work even with 12 licenses. And we can work with a package of guest licenses, of guest access points, in which you are going to have, or you're going to be able each month, you're going to be able to customize and personalize depending on the traffic, depending on the flow per se. Okay, so that is the beauty of AS 2.0. That is scalable, is flexible, is versatile, and it helps the medical personnel, our heroes out there. It helps them to carry out their work more easily, and for the patients that we can do we can go one step beyond in order to care for patients as well.
Thanks a lot, Frank, for your, first of all, kind words about the solution. We are very happy to hear that you like it so much, and thanks a lot for introducing the packages. Yes, indeed, we do have special packages, and we extra included the price there because we knew the price questions will also come up. Those are specially designed packages for you to just go and start. Yes, it doesn't only include the licenses that you need and the free licenses for everyone you would like to invite, but it also includes the training. So everything essential that you need in order to get started. We definitely want to enable the healthcare sector, and therefore, if you are coming from the hospital, if you're attendee from a hospital, or if you're a caregiver, if you're a doctor, or whoever directly works also with the patients, and you need a support now, please get in touch with us, and we are going to make even more special condition, even a better offer during the COVID times, that you just can start and go, right? So for us, it's at the moment, it's not about the price, it's about enabling you, and those special packages do exist. But please reach out if you're very interested to start using the solution, to start working with this and enabling your team. So, and we will discuss the thing further. So it should, at no case, be a showstopper if it is. Again, Frank, thanks a lot for sharing. Thanks a lot for such a detailed description. And I see we also have a lot of questions already now. To be honest, I have to figure out how to work with the tool. The tool is new for me, but I already could scroll through a few questions. But before, of course, don't forget that. As I said, get in touch, right? Get in touch after the webinar with us. With us from Ubimax, with me directly, with Frank, and of course visit the blog of Rafael, right? I mean, Rafael will be happy if you do so. I believe it's full with useful information, and I mean, Rafael is really one of the most futuristic doctors I met so far, having all the smart glasses. I don't even have all the smart glasses in my home office, and you do. So that's very impressive. Here is all the contact information, also the Twitters. Please feel welcome to follow everyone on Twitter. I somehow didn't include the Ubimax Twitter, but we also do have one, so please do not hesitate. Yeah, but now let's jump into the questions, because I think it's definitely an interesting part. So I read a question, now I don't know how to get it back, but there was a question about an AR marker. So if the AR marker is tracking objects directly, or it's a marker basically in a video, yeah? In this exact package, it's just a visual marker. It's not tracking the objects, but we also have another option, which is called XAssist, and it is tracking objects, right? So it has a direct object tracking functionality. And as a product manager, I can also say it will be a part of this solution as well, right? So just a little glimpse into our roadmap. We will have in summer a major release also of the remote assistant solution. So we constantly work on it. And we also have the solution in the focus now. And we will also have the tracking, basically tracking of the objects also enabled. So I hope I could answer the question. Next question is, how would you approach vitals via telemedicine? Does this mean just simple vitals? Any extra equipment needed on the customer part? I'm not sure if I understand exactly the vitals part. Sure, go ahead.
Yeah, maybe I can answer. I'm not super familiar with the platform, obviously, but I've seen it and practiced with it, and we connected. And the vitals are not integrated into the platform as I understand it. That's why I was mentioning that these days it's really so easy to potentially with wearables remotely that the patient is wearing, get those vitals up to the cloud and then back to the platform. So maybe in the future, but right now it's really not integrated with the actual vitals displaying on the screen, as far as I understand. It's just enabling the video and audio communication with the ability to telestrate or guide by drawing or by signaling. So the vitals issue is still not something that is enabled, as far as I understand. The patient vital signs is, I think, what they meant.
Okay, yeah, sorry, I do understand it now, indeed. I think there are a few questions actually in here. Any extra equipment needed on the customer part? So in order to use a remote assistant support, no extra equipment is obviously needed. You need a software, right? So you just install it and it's very simple and then you're ready to go. So as out of the box with the quick start packages, we indeed do not have vitals out there, right out of the box. But as I mentioned before, we do have an extensive experience in a backend system integration. And if you have such a system, right, we can easily integrate and then show those vitals in the part that you have in your browser, right? So you can always access, for example, reports from your computer, right? You can see also some kind of analytics and etc. Therefore, if you already have this vital stored somewhere, or you have this information in your backend, we can connect our system to your system and do show vitals as a dashboard right after you log in. So this is definitely possible. We cannot hear you.
I'm sorry. I wanted to maybe ask add that something as easy as Health Kit, Apple Health Kit, which most of the wearables out there, commercial ones, can store the vitals in Health Kit, in the cloud, and as easy as enabling Health Kit display on your screen would really make a great difference, for healthcare especially. It'd be really amazing.
Yeah, I definitely will take this point also with me. And I said we do provide a dashboard information also, but it's a matter like we won't have, of course, the information, right? So, and if you already have this information, we are just happy to show it and make, for example, a nice dashboards out of it. So that's definitely possible. So, yes, thanks a lot for adding, Rafael. That's very valuable. I'm struggling a bit with the program. I think I'm scrolling through the questions. So, Rafael, maybe you can actually answer another question. The question is, while using smart glasses, isn't it actually being more distracting?
No. The good thing about this platform, obviously, is that it's agnostic to any device, from a cell phone using a smartphone that most people would have, because we have to think that the globality of the world itself is probably very limited, the amount of countries, the amount of people that can have access to smart glasses, or even high-end smartphones. But any smartphone up to the latest smart glass, the platform is agnostic to it. And the issue of distractibility, not really. If anything, is less distractible. I think the smart use of technology. So if I have a glass on my head, let's say I have a Vuzix Blade in here, and I were to have a display of radiologic images or vital signs in front of my eye, and I can be talking to you. I don't have to be looking up at the vital signs or looking up at the X-rays. So the device, again, technology used in a smart way, the device allows you to focus. And that's why in many ways technology is enabling us to be more empathetic, to focus on your eyes, to be able to be close to you, to be able to humanize that lost art of medicine. So the device is, if anything, decreasing the device is not there. You don't need to be playing with the device as you are nowadays. When I see a patient in the office, for example, the patient is there, and I am here, looking at the EMR in the computer and asking questions. Now I can ask questions to the patient, and I can have the EMR maybe in front of me, the dashboard from Ubimax, for example, in front of me, so I don't have to be, turn around, from that patient. So instead of disconnecting, I am connecting with the patient.
If I can jump in for a second,
yeah,
because this is really interesting. You see, Dr. Grossman is a very modest man, but he actually revolutionized healthcare as we know it. Ever since you took those that pair of Google Glass Explorer, the first generation, and John Nosta came up with this that article of Force magazine. Ever since then, we have been working not only healthcare professionals, just like Dr. Grossman, with the companies and even Ubimax, we have been working on these technologies. So there was an early age. And this is important because now we're in the third generation of smart glasses. That was first generation back then. Okay. Right now, this is not something that you try, or is something that is not just a toy. It used to be a toy before. I understand that 4, 5, 6 years ago. Nowadays, this is a ready-to-go technology. So it is not something that you toy around with. It is a solution. It is ready to go, and it is being used widely and more widely than we realized.
Thanks for aiding, Frank. And Rafael, you brought a very interesting point with, for example, showing the vitals directly into the screen, right? And we didn't, of course, see the purpose of the webinar to just talk about our solution, but here I feel it's a very good point to mention that remote support, which we're talking about now, is just easy to start, right? And we think it can enable multiple teams already today. That's why we also talk about it, and we suggest to really take it and use it. But what you just mentioned, for example, showing the vitals in the smart glasses while talking to the patient, right? This is, for example, also possible. We have other solutions like that allows you to do a better training, for example, or better documentation. And what can be done there is, for example, you turn on the smart glasses, you have the information about patient displayed right there, right? So you don't have to look at the PC all the time. And that's the experience I also privately made when I went to the doctor. Very often I feel the experience is not that personal because the doctor always have to document, and I understand it's essential, but there's like typing, and yeah, I also kind of want attention. So, and this is, I think, what you can make better in this case. And if, for example, you can also use when required, obviously not all the time, but such a modules as speech to text, meaning, right, if you talk something with a voice, right, it will get directly transcribed and documented. It means you don't have to actually go and actually type. So first of all, you'll have information about the patient. You might also be shown the next steps, what you need to do. For example, if you're a junior doctor, right, like a more experienced doctor like you will not need it, but someone who's more junior might benefit from the steps, right, like tips, like what can be suggested to the patient. And then at the end, you have it all documented. So there are many different ways how you can utilize a modern technology, the platform, the smart glasses, and etc. So that I would say the use cases are really even unlimited. So the remote support is just something that you can take. You don't need necessarily even to do the backend integration, although it's always a possibility, and they can just go ahead, right? So that's a good point about it. Rafael wanted to ask you, is the documentation for you an issue, for example? Is it taking a lot of time from your side usually and from your colleagues?
Oh, absolutely. The documentation is a major problem because, for the last, let's say, 15 years, more or less, we have gotten into digital health, digital medicine, e-medicine, right? Everything is in a digital format, which is very good. It's very good in order to build. It's very good in order to document, to maybe study, the different data points and then come up with the better medicine. But that has, in a way, separated us from the patient. Now, like I said before, the patient is there and you're here in front of the computer. And in the past, before digital medicine, we were in front of the patient and maybe we were taking notes. So we had a scribe behind us. And so it was a not very smart use of technology. Now you have the ability to document on the go. You might have a remote scribe, for example, that is listening and remotely present, documenting the EMR. And so having the ability to maybe recognize a speech, speech to text, and you can dictate, or you can have systems that, nowadays, and this is the beginning, but in the near future, within the next 10 years, you'll have things like ambient clinical intelligence, where you have everything is being seen and heard, and everything is being populated by AI in the chart. So at the end of the visit, the AI has already, so all those things are coming. So documentation is a major problem. You need to document, but it cannot be documentation that separates you from what medicine is, which is a relationship between two humans, the doctor and the patient, or the provider and the patient. So this is a very important point.
Yeah, thanks for sharing. And as a patient, I can really confirm, because I very often felt that I would like to have some more personal contact, because when I go to the doctor, it's usually, the private topic, and you would like to get some eye contact. That's very important, I can confirm. I think, let me just shortly check with the time. Oh, we have 1 minute left, but maybe let's take one last question. Who needs to have the license? The one that receives the remote, wait a second, I need to scroll, the remote support, or the one that provides the remote support? So the beauty of it is actually it doesn't matter, right? So whoever has a license can start a call, can send the invitation via SMS to email to the person who he wants to talk to, either to someone to give a support or to receive a support, and then you can establish a remote assistance call. So that's the beauty of it. It's you don't have to be binded to it, so it is independent. So you can basically decide who has a license, and then the other one can just get an invitation. So I think we are already a bit out of time. That's a very pity, because I felt we have a very interesting discussion. Rafael, Frank, you shared very interesting insights, and Rafael, so many insights from indeed from the hands-on hospital operations, from your experience. They are very, very valuable. So thanks everyone for taking your time, and dear participants, thanks a lot for listening in, for attending. I hope it was interesting for you. And as said, you can still see the contact details on the screen. Do not hesitate to get in touch with any of us. We'll be happy to hear from you. And stay healthy and safe, everyone. Yes. Goodbye.
Thank you very much. A pleasure.
Thank you.
Bye.